So welcome everybody. We have an hour, and thank you all for coming. We've got updates from the Vice Dean group, and they'll come through in this order. Just a few items for information that the 3% budget cut we were planning for has now become a 1% budget cut. So that's, I think, very positive. And within that 1% budget cut, we're working pretty hard to see if we can absorb that 1% with one-time funds, which would give us kind of a breathing year to sort things out. And within the year, starting this April, the expectation is we'll be starting a new parallel budget model. So both budget models will be going on at the same time for a year, and the next fiscal year will be the new budget model, but all faculties will be held harmless for that year, meaning we won't have less money than we would have had, so that doesn't mean the same. We still may be facing cuts next year depending on grants and other things, and then following that hold harmless year, we'll be moving into the budget model. This has been described to you, I think, in several different occasions. We've had both Huron Consulting and senior administration of the university down here presenting it, but largely is a more decentralized model where the funding from tuition and the grant in effect come to faculty. Faculties then pay a share of costs of the university and a share of a university fund that is then used to meet priorities and provide some equalization. Various drivers are being used, and we've not been in a position to validate the numbers at this point. I think that'll be coming in the next few months, and there will be ongoing a whole series of presentations about the new model that you will have an opportunity to participate with. But it's generally been drivers such as student numbers, i.e. tuition, percentage of research of the university amount, and there'll be more detail available, of course, as we approach April. Of course, we have a new government in place that we are all waiting to see what consequence comes with that, positive and negative. There aren't signals other than, of course, the instruction in this fiscal year to limit the rate of rise of pay to 0 for UMFA members. Certainly discussion around their fiscal stresses is very public, and we're waiting to see what impacts that may bring. We continue to work very closely with the ministry through the deputy and others, and we'll continue to do so as the next year unfolds. Now, the areas that you'll hear about today, we of course continue to focus on interprofessional education across the faculty. We're working hard to establish a new chair to promote interprofessional education and innovation, and are working with Mr. Rady in that regard, with some of the money that he has donated as part of the naming last year. We've had a good year in research, increase of 16%, actually amortized over the previous year. It's more like 30% as a one-time increase. We're close, we hope, to having the Indigenous Institute of Health and Healing go through final Senate approval. And we've begun a rather extensive review of student services in the faculty, including issues of wellness, mental health, and other services, and how to both equalize them and make them relevant to our students. Now, the strategic framework you've all had some participation in. We actually began with the college's strategic frameworks, and some of them had just been developed. The intent was to take those and develop a high-level strategic framework that will guide us in the next few years as we work to define our own priorities. And we expect the colleges to continue with their own strategic plans for accreditation and other purposes, recognizing that as we move forward, the college strategic plans will be integrated into the faculty strategic plan, which of course will be integrated into the strategic plan of the university. All of the college plans were reviewed. We reviewed other jurisdictions. Marcia Zeke has been instrumental in all of this work, consulted with college deans and vice deans, surveyed faculty, and had over 500 responses. We have a draft that was reviewed by the Dean's Council and culminated in a strategic framework with these principles. Of course, the shared vision, shared values, the mission then of the colleges are within that, and the shared strategic priorities then of the faculty become those of the colleges. Vision is to advance excellence in healthcare through innovative research and health professional education that supports collaborative practice. The values are community and collaboration, scholarship and innovation, equity and inclusion, professionalism, and social accountability. The complementary missions of the colleges recognizes, of course, that each college has a unique but a complementary mission, and that they will be reflected in the strategic framework. 6 priority areas were defined: education and the learner experience, research, teaching and the work environment, community partnerships and collaboration, Indigenous health and achievement, and investment in our resource base. In education and learner experience, sustain and enhance our educational programs and offer flexible learning opportunities. Includes working with Indigenous communities to support pipeline programs that ensure a culturally safe learning environment, provide an outstanding educational experience, provide education and training opportunities that recognize the learner's diverse career paths, and there are 12 supporting actions for this priority. In research, create a state-of-the-art research environment that's nationally and internationally competitive, enhance opportunities for community-based research, and there are 13 supporting actions. Teaching in the work environment, attract, retain, and develop staff and faculty members of the highest caliber who achieve professional excellence in their contributions to the faculty. Increase staff and faculty satisfaction within the work environment. Focus on ensuring a safe and respectful workplace with 10 supporting actions. In terms of community partnerships and collaboration, offer interprofessional education that will enhance the provision of clinically integrated care, actively build and enhance partnerships to contribute to the communities we serve, include Indigenous health partnerships for collaborative care, and this is with 14 supporting actions. For Indigenous health and achievement, develop a full range of resources to support Indigenous health and achievement across the faculty, create an Indigenous Institute of Health and Healing, enhance opportunities for partnership development with Indigenous communities with 11 supporting actions. Investment in our resource base, ensure our capital investments and resource allocations enhance the working and learning environments to meet current and future needs, balance staff and faculty levels to meet academic and administrative requirements with 12 supporting actions. So achieving these priorities, we think, will allow the faculty to realize its shared vision to be a leader in innovative research and health professional education that supports collaborative practice. We're happy to receive feedback today or subsequent to today, and then ultimately we'll go to the Dean's Council for approval. The full draft of the strategic framework is on our website, and this is a feedback loop that you can use. So maybe we could break here before we move to the Vice Deans. Any questions, comments about that or any of the other opening comments? I've always been fascinated by such a shy group. Okay, so we can then move to Sarah Israel's Academic Affairs. Sarah?
Thank you. As you know, Academic Affairs includes a variety of areas within the portfolio, which includes some of the governance aspects for the faculty. We took on responsibility for a new Office of Educational and Faculty Development, which I'll come back to in a moment. We are caring for a faculty level awards committee, and we're, of course, responsible for career advancement across the faculty as well as a number of other areas. I'd just like to say I'm not going to talk about all of them. I would like to talk about 3 of them. So first I'm going to talk about the Office of Educational and Faculty Development. The development of this unit was discussed in the run-up to our amalgamation with representation from all of the colleges. In slightly less than a year ago, what we did was actually to create this office by moving academic staff who were in the Department of Medical Education into this unit that would then provide service across all the colleges. Over the course of approximately 10 months now, we have managed to put together a group of very talented people with expertise in various areas that are supporting things that we did before, including curriculum development and evaluation in undergraduate and postgraduate medical education, but also looking at helping in educational development across all of the colleges, and in that way the liaisons with each of the colleges have been identified in the office, and we're moving towards that. The group is also, of course, continues to be responsible for providing faculty development workshops on a whole variety of topics which are now available. The office is being directed by Joanne Hamilton, and we have recently acquired some new staff, particularly for areas related to research and evaluation. The awards committee grew out of the awards committee that had been established for the Faculty of Medicine, and we have now made it a new Rady Faculty of Health Sciences wide committee, looking particularly at external awards. We meet quarterly with Brent Deere from VP Research Office to help us identify good nominees. Brent helps us develop some of those nominations, some of which are quite complex. And for those that don't fall in his purview, Marcia Zeke has been helping us develop nominations. I'm quite determined that we need to nominate more people in our faculty for external awards to recognize some of the really outstanding talent we have. The third area I want to talk about is promotion and tenure. As many of you are aware, this cycle was the rollout of the new faculty-wide process and a new promotion and tenure guideline for the whole faculty. And this presented challenges for people in every college. Because this was developed by a consensus committee that worked on this on the run-up to the amalgamation, we had to reach an agreement for one process and one guideline. And so I think that this has been a trial year for each of the colleges in terms of meeting this new process. We aren't quite finished yet. The deadline to have everything in the provost's office is the end of this month. I think that the process has run fairly well, but I haven't asked for individual feedback yet. I just wanted to give you some stats about what the numbers looked like for promotion and tenure applications in the faculty this year. So we have dealt with a total of 52 applications, including tenure and promotion. You can see how they are distributed across the colleges. Because we have a new process, the university allows for people to choose either the tenure or promotion guideline and criteria that they had in place before the amalgamation or the new one. And I thought it was interesting that although many people chose to use their previous faculty's guidelines for promotion and tenure, we had significant uptake for the new guidelines in this first rollout year. And finally, for promotion, these are the ranks of applicants that we have reviewed. So there were a total of 45. As is typical, the majority are always from the assistant to the associate professor rank, but as you see, we had a distribution across the ranks. We have one more meeting to go before we have finished all of the review committee meetings for this year. We will be starting very shortly workshops for people who are interested in tenure and promotion for the coming cycle. So as you can see, Diane Hebert-Murphy, who's the Vice Provost of Academic Affairs, will be giving 2 workshops, one on the Bannatyne campus and one on the Fort Garry campus. Her focus is primarily for members of UMFA. And I will be giving 3 workshops. One is a webinar, also to which all individuals, regardless of the type of appointment you have, are welcome to attend. Thank you. Do you want me to answer questions now, or?
Sure, we can maybe take time for any questions for Sarah?
No.
Okay,
Okay.
Thank you. Jeff?
Thank you. Thanks very much. It's a pleasure to bring an update on the activities of the Continuing Competency, i.e. CPD, and Assessment Office in the Rady Faculty of Health Sciences Centre. Like other portfolios, we're building something new. There's our Habitat crew. There's Elia. We had a good group working, and I do see the work we're doing over the last year in our portfolio being very similar in terms of working with new people and trying to construct something that'll be of real use. We've been building our team. We have been building relationships with external groups. We've been building high-quality CPD programs that have been really exciting over the last year. And I'm going to end with talking about the new web platforms that we've built. Here's our team. We have, as you can see, many of you will recognize these folks. We've got CPD leads from each of our colleges, each of our 5 colleges. Brenda Stutsky leads our online learning and technology efforts, and Natalie McLeod-Schroeder our assessment program, which is really receiving referrals of clinicians in some difficulty with our regulatory colleges or re-entering practice who need assessments for fitness to practice. Megan Ward is our business manager, and Tolu is my assistant. So that's our team. In terms of our relationships, we've been actually meeting systematically with all of the regulatory colleges. We haven't met with them all yet, but we have a schedule to at least. We've met with about 5 of them, really just exploring our mutual interests in terms of the Regulated Health Professions Act, which really unites practice in the way that our faculty unites us academically. We've been talking about continuing education for health professionals, obviously about interprofessional education, which is such a focus. We've been talking about our assessment services for clinicians in some kind of need that we're eager to expand, and also talking about internationally educated health professionals. And the third bullet there refers to a working group that we have across colleges now that's actively exploring the way that we as a faculty need to be holding up and speaking to the nature of the work we need to do around helping new Canadians enter practice in their chosen professions, and to be part of that community, and really to get our faculty together across colleges more in that work. Also, national examination bodies. We've got 5 high-stakes exams for a variety of professions and are eager to grow that. So we have been looking out and reaching out to those in those kinds of ways. Of course, we've been building very high-quality CPD programs. I'm going to highlight, I guess, some of the newer ones. Barb Shea is our lead for Rehabilitation Sciences, and we're having our second Back to Anatomy morning for physios and family docs mainly on February 4th in just a few weeks in the Anatomy Lab. Anatomy have been our partner in that, obviously. The Meds Conference is led by Sean Bugden, who's our pharmacy rep, with Jamie Falk, and we're going to have probably over 200 pharmacists and family docs and nurse practitioners and others at our event on February 11th in this room. And it's just a very dynamic event sponsored by CPD and Pharmacy. Coming up next month also, we have a First in Canada event focusing on a new scope of practice for dentists in Manitoba. There's some a growing role for that, and we have a course on sleep apnea and a role for dentists in terms of that Casey Hine, who's the Director of CPD and Dentistry and Hygiene, has been working together very carefully with faculty in the College of Dentistry as well as the Manitoba Dental Association. And we've got a new webinar series starting in just a week where we're going to be using webinars for the first time in terms of education. And we have one on septic shock with Anand Kumar coming up. That's sponsored by CPD Medicine. So lots of cool stuff. We're also very interested in interprofessional education. Christine's going to be saying more about the broader picture here, but in CPD and in CCA, we're looking particularly at what we can do with clinicians, and we have a group learning event called Healthcare for the Elderly coming up on April 7th, again in this room, that's going to mix group learning along with table-based interprofessional discussion in terms of care of the elderly. We have a visiting speaker and a lot of excitement about this event, and we get a nice mix of professions at that, and indeed all of our events, but this one in particular. But of course, the most signal interprofessional event that we have going on right now in the Faculty of Health Sciences is the Rady to Sing Choir. Every Tuesday at 5, up there, we'd love to see you. We've got now 35 people singing. We're going to be at CCME in May. We have other exciting opportunities that we've been approached about, and there's nothing better going on right now here than this choir, honestly. So, lastly, new web platforms. Just watch my time here. We actually have 2 new web platforms. We have a new Red Dot site that really is our portfolio site that talks about who we are and what we do. There's a button for each college there in the second bullet. Stuff about our assessment program, our IP courses, and hats off to Melanie Gattoro, who's been just so helpful in getting this site up and running. So that's there now, replacing our old site. But more importantly, we've got a new exciting web platform that we've built that basically is a place where courses for clinicians of all stripes can be advertised, where people can register and pay, where we can manage all those kind of aspects of events, but more importantly, that also has a learning management system for online learning, where you don't need to be a U of M student or staff to register. And we have our first online course up and running on cancer survivorship. This is was a big build that Sean Beach and myself and our team built when Sean was with our program, and we're excited about it. We have built it for the faculty, so there's little icons on the top right there for all of our colleges and others. And we're hoping that there'll be good uptake in the faculty, as this being a great place for you to advertise and market your event. We've had great support from Alana Simon's office in terms of very high quality images. Julie Doan from our office was responsible for those breathtaking marketing posters you saw just a few slides ago. And we are looking at ways of building a great platform for CPD for clinicians. Each event obviously has its own page with maps, and of course we're offering conference and event management services as well. This is all reliant on revenue, so these are fee-for-service services, but we're certainly interested in expanding our role for all of our colleges with regards to event planning. So again, we're building something new. This is our Habitat team, which is the next speaker I think is in there. This is my working group for nursing that we had fun with over the summer. And in CCA, there's a real sense of creativity and adventure and of doing something new that's, I think, got us all energized, and certainly look forward to your support and participation. We do have little handout cards about our new web platform, cpd-umanitoba.com, that we'll have to hand out as you leave, just as a way of making you aware of this new platform that belongs to all of us. So thanks very much. Oh, I guess I don't know if I have time for questions, but.
Any questions for Jeff? Okay, Christine?
Hey, thanks for showing that picture, Jeff. Hi, everyone. Nice to be here today to give you updates on all the many and varied things going on within my portfolio of education. I'd like to start with the Office of Interprofessional Collaboration. As you can see, our college leads are Laura MacDonald from Dentistry and Dental Hygiene, Amanda Condon from Medicine, Fiona Jensen from Nursing, Dana Turcott Pharmacy, and Moni Frick from Rehab Sciences. Administrative support is Susan Coutu. And just to reinforce, any of you who've had any interaction with this group know they're an amazing and dedicated team who work very hard to develop interprofessional programming and support for students and faculty, as well as other interprofessional scholarly endeavors. So to look a little bit at some of their work, here's a draft of work to date on the two-year interprofessional collaborative care curriculum. It is based on the CIHC, which is Canadian Interprofessional Health Collaborative Competencies. To develop this curriculum, I won't go into a lot of detail now. There is a faculty and student lunch information lunch hour session being planned for spring, where more detail can be shared and more opportunity for questions with the experts, those who have actually developed the curriculum. So stay tuned for that. But just to let you know that the OIPC has met with the deans and links with the relative curriculum committees regularly to update them on their work and to get feedback. September 16th was our first offering of the collaborative care curriculum, and I've got lots of fantastic pictures of that event. Some of you may have read more of the details that are in our newsletter, and we'll also be posting, more information as well on our website. It was a focus on engaging our communities, which was aimed at developing an awareness of the IP competencies of team communication and team functioning. If you remember the visual I had, each of the 2 years of the curriculum focuses on different interprofessional competencies. So we had approximately 400 first years, Rady Faculty of Health Sciences first years from the programs. We had 52 interprofessional cohorts that met in person on that day. And then ongoing over last term, they had 2 online discussions where they discussed some of they had specific guiding topics and guidelines that they met to discuss. We had a lot of feedback. We requested feedback, sought it, received it, met with student groups, including 15 student leaders from the various programs, and we incorporated their feedback, everyone's feedback, faculty as well, that we'll be using in future events. For example, the med students told us that because they use OPAL, having information on UM Learn was problematic, so we figured out a way to make sure it's on OPAL for their ease. Difficulties meeting online. We actually thought the students would really appreciate meeting online. They're a technological group, more than we were in our day, but we thought that would help them. They actually prefer the in-person. So we're going to have more in-person meetings or have them do some of their assignments in person. Others were they wanted more case-based kind of work, but of course that was just an introduction last fall, but we will be having, in fact, the next activity is case-based. Also decide to streamline communication with the students via class reps, so that they felt that was a better way to get the information on the activities to the students rather than have every student try and read online. So that was another change that was made. So the next activity, term 2, is termed Qubit. Again, this group is very good at having very catchy titles for their activities, and this stands for Communities United for Better Health by Engaging IP Teams. This activity actually starts tomorrow, the term 2 activity, where again the 52 interprofessional student groups, and it will be the same groups throughout their 2 years of the curriculum, so they're going to really get to know each other. They'll be meeting to review a case study, brainstorm ideas, and then over the term work together to develop a pitch on a community-based initiative. The leads have met with all their profession-specific students to provide an overview of Term 2, again, to ensure that, and this is where the idea of having, student communication specifically with student leaders became apparent, but it was much more helpful. The students were all feeling that they had a better handle on what to expect in Term 2. We have the interprofessional facilitators who will be working with these cohorts, all trained and ready to go, and really appreciate their enthusiasm and participation, because we couldn't do it without their participation, so that's really helpful. Moving on to the next area of my portfolio, the interdisciplinary health program. Warm welcome to Dr. Mark Noctegal, who started as director. Mark is an associate professor from the Department of Biochemistry and Medical Genetics in the Max Rady College of Medicine. And would also like to give a sincere thank you to Dr. Shaheen Shushtari from Community Health Sciences, who served in this role for the past 6 years and who is now on a well-deserved research leave. The Bachelor of Health Sciences, Biomedical Sciences concentration will start intake into that next year. So students who are wanting to go into that concentration will be looking at their GPAs and working towards that. We do have some proposed changes that we're working on in the Bachelor of Health Studies degree that are under development for submission this fall to 4Cs. This is being facilitated, the work of this group, this subcommittee in the Bachelor of Health Studies, by Joanne Hamilton, who was mentioned by Sarah as the director of the Center of Educational and Curriculum Development in the Rady Faculty of Health Sciences. And she has really been instrumental in moving us along and looking at what sort of changes will help this program really become even more appealing to students. The governance structure in the IHP required some significant changes with the move to Rady Faculty of Health Sciences, so a shout out to the Governance Committee, Donna Collins and Marie Edwards as past and current chairs for all their work and support in that. Surprising the things we've learned, for example, the IHP Council bylaw terms of reference and the changes needed with the move to this faculty, the need for a specific appeals committee for courses that come under the Faculty of Health Sciences as opposed to any particular college, and other fun things. The other area I'd like to discuss is the Clinical Learning Simulation Program. Dr. Rob Brown, of course, is the director of the simulation facility and the programs related to that. Part of the something new that we start out, I guess it's not that new, but since I last gave an update, is that we have a Rady Faculty of Health Sciences Simulation Planning Committee. And the purpose of this committee is to look at all the colleges and their simulation needs and activities to see if we can do more planning together and more, best use of the facilities and equipment, making sure we're just buying one of a piece of equipment that maybe is not going to be used all that often, etc. We also and of course there's representation from all the colleges on that planning committee. We also have a project, simulation-based education strategic planning project, that we received funding. And the goal of this project is to develop a strategic plan for Manitoba regarding the current state of health-related simulation, to optimize the resources province-wide, and also to create a simulation network and to learn from each other. Dr. Nicole Harder from the College of Nursing is the academic lead on that project, and we have steering committees from, of course, the Rady Faculty of Health Sciences, Medicine, and Nursing specifically, as well as Brandon University, the WRHA, and Red River College. And of course, this committee also links with the Simulation Planning Committee within the Rady Faculty of Health Sciences. The other area, interprofessional clinical practice opportunities, those will be coming as a result of the plan of the OIPC as well. I talked about the academic curriculum, but there'll be a clinical practice curriculum as well. Of course, you're familiar, I'm sure, with the student-led initiative of WISH Clinic. Service learning is an area that is currently, all medical students have that opportunity, but there are excellent interprofessional opportunities that we're looking at incorporating as part of those. And the Rural and Northern IP Placement Pilot Project, which we're working hard to get off the ground. We've recently advertised for an interprofessional practice coordinator. If anybody wants more information on that, please email me. We have an IP Practice Initiatives Committee with representation from all the colleges. And we started a smaller working group with people who have experience in planning placements in the North, which is a real skill in itself. Of course, there's scheduling and supervision challenges related to anything interprofessional, but we believe we can overcome those, and we're working very hard to do so. That's my report. I'd be happy to take any questions.
The Associate Dean. Christine, thank you for your great report. That was very helpful. I do have a question around the clinical practice curriculum from the IOPC. Could you give us a little bit more background about that? It was something we were actually discussing the other day, that clinical practice is the optimal place for the interprofessional learning to happen. So I'm excited to hear about this.
Right. Well, I don't have a lot of detail right now. That will certainly be something that can be presented in more detail at the lunch hour session that will be coming up. But I could just say at this point that what we found last time when we were trying to do clinical practice experiences in an interprofessional way, that it was very challenging to bring students together to discuss patients and to have facilitators with all the different schedules that we had. And so we're looking at something more student starting with the students, so that students would have assignments when they're in the clinical area, that perhaps with one of the patients they're working with, that they reach out to at least two other professions and develop a care plan or something. And those other professions don't necessarily have to be students. They might be practicing professions. So that way, every student in a clinical area is working with other professions. But the way we were trying to do it before was trying to schedule specific student interprofessional activities in the clinical area was really, really challenging. So those are some of the ideas we had right now, but they're going to definitely need more fleshing out.
Thank you. That's very helpful. And the plan or the idea of it being a student-led assignment, I think that's perfect, and that's actually what some of our students are doing already in their focused learning assignments within their clinical courses. And so I think we have there's a lot of fodder for discussion and building there. That's wonderful.
Great. Thank you. Any others?
Thanks, Christine. Catherine?
Well, good afternoon. So just want to give you a bit of an update on the proposal for the Indigenous Institute of Health and Healing. As Dr. Postel mentioned, we're awaiting final approval from Senate on that, or a final decision from Senate on that proposal soon. We, in the meantime, have been working and establishing our structures very much along the lines of an institute, in that we've begun to fully amalgamate the 3 units that will comprise the institute, and that includes the Northern Medical Unit, the Centre for Aboriginal Health Education, and Manitoba First Nations Centre for Aboriginal Health Research. We do have a College Liaison Advisory Committee as well, and that includes representatives from each of the colleges, and our vision and our values are very much in line with that of the strategic framework for the faculty. So I'm just going to spend the next little bit of time updating you on a couple of initiatives that we have planned. One is the Truth and Reconciliation Action Plan, and the other is our approach to community engagement as an Indigenous institute. So, and I just want to acknowledge Dr. Marcia Anderson-Dakota, who has been largely responsible for the leadership of the development of this action plan, and she will be assisting in answering any questions that should come up. Thank you, Marcia. So the action plan, I think everyone may be, or maybe not, be aware that the Truth and Reconciliation Commission issued its final report last year, and along with that were 94 calls to action. Although there were some that were basically attached to health, there were more that were attached to education. And the only real approach to addressing some of those calls to action is through essentially a social determinants of health approach. So that's the structure that we've taken. This action plan has been developed in fairly collaborative process. We did have an open workshop here. Through that, there came several key themes, 5 key themes. The working groups were formed to address those themes. We did seek consultation with our knowledge keepers, did do presentations to the Dean's Council, and offered opportunities for partner feedback. I should just mention that there are a few copies, hard copies of the draft action plan here. If any of you are interested and would like to provide feedback, please pick one up or contact Darlene, who can get a copy to you, and we'll be finalizing that over the next little bit. So the 5 themes, I'll take you through them one by one. The first is honoring traditional knowledge systems, and specific to the education system, it means developing protocols and guidelines for learning from our knowledge keepers, and looking at learning opportunities for some land-based experiences. We have had to look at some of the policies and procedures as well, particularly around hospitality for our elders and knowledge keepers, and remuneration. The safe learning environments and professionalism. We have been working with a variety of different committees and individuals looking at the development of anti-racism education across all of our colleges. Some clear policy. And it's important to do this in collaboration with the WRHA. Although we train and distribute the degrees for healthcare professionals, the practicum training and the ongoing training and teaching throughout the course of that education is largely done in collaboration with the WRHA. So we wanted these to be consistent. And then also a development and implementation of process for addressing racism. The student support, mentorship, and retention. We do have a faculty-wide working group, student needs assessment and environmental scan, and it's our hope to address any gaps and build on strengths that are identified. Education across the spectrum. I think we're all aware that we have a very low percentage of Indigenous young people who do enter the colleges. Currently, we're engaged in a couple of different initiatives, working with communities on defining some outcomes for that. Professional development for our teachers. We've just finally finished the development of an online cultural safety training program. It's about 8 to 10 hours. And it essentially is a very self-reflective learning process. It's all online, and you're grouped anonymously with others from the province. So it's a very safe environment for learning about Indigenous cultural safety. And we will be promoting that a bit more. This is our first year of actually running it. It'll be a short year, but the promotional material for that will be coming out within the next couple of weeks. I've also been doing curriculum mapping of the current content within the faculty or within some of the colleges. So one other item was the closing the gaps in admissions. We do some outreach, but not a lot. And by we, I don't just mean the Indigenous Institute, I mean the faculty, and in many cases the entire university. So there are some opportunities currently for learners, but it'll be important to expand that to additional junior high and high school math and science opportunities, because those are the weak areas. Again, policies and processes, looking at written material for messaging, strengthening those processes to look for candidates, and so that work is ongoing. We've just been very fortunate in receiving funding through the Indigenous Initiatives proposals, and we are focusing our efforts on community engagement that will support the Truth and Reconciliation Commission in these 4 areas. So the honoring traditional knowledge, longitudinal health career, specific to science and math, looking at admission policies, and then some urban Indigenous health research. So in summary, our next steps: continued relationship building with our knowledge keepers and elders, the finalization, communication, and implementation of the TRC action plan, and with a positive decision from Senate, we will be holding a launch of the Indigenous Institute of Health and Healing either in March or April of this year. So, any questions? Guess not. Good. Thank you.
Kevin?
Okay, thank you. So I'm here on behalf of Dr. Peter Nickerson, the Vice Dean of Research, and most of the slides are his, so please don't ask me questions about the first few slides. So we are, as you know, primarily an educational institution, but one of our major mandates is to do research. So one of the things I want to do is to put things within a little bit of context. First of all, we are, first and foremost, a network. Each of the former faculties, now current colleges, had a number of other groups that they interacted with, and so collectively we interact with a large group of other organizations, including the Regional Health Authority, a number of other universities, faculties, research institutes such as Children's Hospital, Rio, etc., Health Science Center, and a number of the hospitals, which you can see here. So one aspect of this that I'll allude to towards the end is that we already have connections amongst a number of these agencies, and so the framework is already there for developing new approaches for collaborative research. With regard to other things within the context of this, to give you a sense of the framework, it's a busy slide, but basically the major point here is for those who are familiar with Tri-Council, particularly CIHR, there are 4 pillars of research which are indicated at the bottom. And towards the top, there's other wording for what each of these pillars represents. Basically, the biomedical, the clinical research, health system research, and population health research. So to support these particular endeavors are a number of research designs and core platforms that have been instituted over the last couple of years and that we're still working on in order to increase our capacity to more effectively work within each of these areas. Another way of looking at this particular framework is at the individual versus team versus cluster signature area. So as I think most of you are aware, there's an increased emphasis now on carrying out collaborative research. That's not to say that that's the end of the individual researcher. At least I hope for myself that's not the case. But within this context are a variety of capacities and such. So startup funds, of course, would go primarily to individual researchers who are brand new, working through the continuum up to major grants, which you see on the far right. And there's no reason why particular individuals can't work from one to another. So members of a large signature area, of course, can work individually or as part of a team. And for those who are aware of this, this has been developed over a consultative process that's taken a number of years. A lot of this was driven by Research Manitoba and its particular changes in how it's carrying out funding. That is, they're funding individual researchers, but they're also putting more into the collaborative type of team and cluster. So where does that take us? With regard to how we're doing, the general strategy that's been developed through this consultative process really falls into three broad areas. That is to generate systems that will support the training and recruitment of highly competent students who will become the next generation of researchers and educators. To also try to streamline the processes to make life a little bit easier. Of course, this is a work in progress, particularly for those who have worked with animals and know what a struggle that is, but we're working on that. And then also to try and generate an area that's better for innovation that will lead into the next generation that keeps us at the forefront. A lot of this is going to depend on sustainable capacity building, and so the office has been working on trying to develop, as an example, core facilities, not only in biomedical, but in statistical. And so obviously CHI is an important component of that. So just to close, one of the aspects is where are we and where are we going? Now, one thing is that we don't have much current access to what the rest of the university is doing, but we do know with regard to Tri-Council funding, which is shown on the left-hand side of this particular slide, that there are several major agencies. We, of course, obtain the lion's share of the Canadian Institutes of Health Research funding. We're not the only ones, but certainly more than 90%. We obtain a small amount of NSERC funding, so there is opportunity there to poach on what the other faculties are doing. And we also obtain a little bit of SHRC funding, so there's opportunities there. Now, I highlight these particular Tri-Council things, and here's another way of showing it, because while all funding is good, particularly for those who receive it, the extra benefit of the Tri-Council funding is that it also determines our ratios and proportions of Canada research chairs and federal infrastructure funding. So the more Tri-Council we get, the more other spin-offs we get also. So these particular values that are shown here are actually out of the Vice President's office, and the nice thing, I think, is that they show this gradual increase, particularly in looking at Tri-Council funding, that's increased quite substantially since the 2010-11 to 13 period. So these are the three-year averages that DIGVR uses in order to give us federal research funding, but it's also used for CRC allocations, as I mentioned. And then finally, the one other aspect that I can share with you is that we also carry out an analysis of the My Research funding, which looks broadly at all funding in My Research tool. So again, I don't know, and we don't know, what other faculties are doing with regard to this. But the nice thing, as you can see, is there's been this steady increase, particularly during the past 5, arguably the past 8 years. This is not due to the amalgamation. All of the former faculty's current colleges were entered into this distribution. So this particular rise that you see during the last couple of years is in fact real. The Dean mentioned this represents a 16% increase over last year, and that's what the numbers are. It's actually about a 33% increase with regard to one-time funding. But because most of us researchers get our funding on a yearly basis, we prefer to show it in this amortized fashion. So it looks like good news. Keep up the good work. And I think the next one is questions.
Any questions, first of all, for Kevin? Any questions about the whole hour? Gossip, rumors? Boring lives, eh? Okay, thank you all very much.